This is one of our biggest challenges nowadays. Normally, once azoospermia is diagnosed, there are very, very low chances and hope. There is very low hope for fully recovery of the fertility. There are only very few cases of secondary factors that may restore our fertility, such as a history of chemotherapy. Normally, a man that has undergone chemotherapy due to cancer may experience a short or prolonged period of azoospermia before he's able to have some sperm test with the presence that indicates the presence of spermatozoa. Men that have a history of drug abuse or anabolic abuse, again, these men may experience a prolonged period of 2, 3, or even 5 years with azoospermia. All these cases are examples of secondary factors that produce azoospermia. However, the majority of azoospermia is due to it's not due to secondary factors. It's due to hormonological factors or due to diminished spermatogenesis. The only form of these non-secondary azoospermic cases that may be reversible is the hormonological produced azoospermia, such as the hypogonadotrophic hypogonadism. And it's the only, maybe the only case type of azoospermia that can be efficiently treated, and these men can experience restoration of their fertility. For the majority of the other azoospermic men, once the azoospermia has been diagnosed, they undergo a number of genetic tests in order to identify any genetic background as a causative factor of the azoospermia, which is the case in 25% of the cases, while in the rest 75% of the cases, the azoospermia is termed as idiopathic, which means that we as scientists, we do not know what is the cause of this azoospermia, what is the causative factor. So we resort for these men in blind approaches, which involves the investigation of the testicles through a biopsy, testicular biopsy or TESA, to identify the presence, to investigate for the presence of testicular spermatozoa. And if we have a positive outcome, we will resort to ICSI, intracytoplasmic sperm injection, in an effort to see whether the spermatozoa, the testicular spermatozoa found in the testicles, are functional enough to support embryonic development and a live birth. So these are two questions for these men. One big question that will be answered only with a biopsy is, do I produce spermatozoa even in my testicles? And this can only be answered at the moment with the biopsy technique, TESA or TESA. And the second and maybe bigger answer is, will these spermatozoa be capable of producing a live birth at home? And again, this question can only be answered through the implementation of the technique and through micromanipulation in an effort to see if these spermatozoa are able to fertilize and support embryonic development. So for these men, the idiopathic azoospermic men, the challenges in both sides, the side of the expert and the side of the patients, are enormous.